Hello, everyone. Welcome to another chapter in ICD-10-CM coding. In this chapter, in these two video lectures, we're going to be covering coding traumatic injuries. This can be very confusing to some people, particularly regarding the seventh characters, but we'll get you through it. Please answer the questions that appear on screen, and they'll help you understand the content, and it will make a little bit more sense to you. Anyway, let's get started. Okay, and again, we'll be covering the text chapter 19, chapter 22, which deals with chapter 19 in your code book, excuse me, on traumatic injuries. And by the end, you'll understand how chapter 19 is organized. You'll be able to apply the key guidelines and recognize the injury types and the rules that drive accurate coding for this chapter. So what does this chapter entail? Chapter 19 covers code categories S00 through T88, and these describe the injuries. It focuses on traumatic injuries, organized by body region, starting at the head and moving down to the ankle and foot. There are other things that are addressed here, including burns, frostbite, and we'll cover those as well in this set of video lectures. And again, you can look at all the different types of things that follow the anatomic site. This could be a superficial laceration, could be an open wound, fracture, dislocation, sprain, injury to blood vessels, crushing injuries, traumatic amputations, all these different things, injuries of muscle tendons, all of it. And again, burns and corrosions are in blocks T20 through T32. Burns are thermal, electrical, or radiation burns. We sometimes think of chemicals as burns, but this is actually more properly referred to as corrosion. And we'll talk about some secondary codes from chapter 20, which will describe the external causes of morbidity to indicate what caused the injury in the first place. And again, some of these codes will already have the external cause in the title, and you have to pay special attention to that. So you wouldn't require two external codes if that is used in the code itself. Another thing to bear in mind is this is a chapter that's loaded with instructional notes. And for open wounds, ICD-10-CM will often direct you to code any associated wound infections. So you don't stop after the wound code. This is yet another chapter where if you don't read the tabular carefully, you will be penalized. And again, here are our old friends in the seventh character. And these are seventh characters. A for the initial encounter, D for subsequent encounter, and S for sequela. If you miss these, it will result in an incorrect code and a denied claim. So make sure that you get these A, D, and S's in the seventh position and think about where the care was being given. If somebody is being admitted through the emergency room or being seen in the hospital, that is an initial encounter. If they're getting follow-up treatment, typically in the clinic, that is a subsequent encounter, so you'd use D. And sequela, also known as late effects, would be followed up from that. And more chapter-specific guidelines, these fracture extensions, right? So something to bear in mind with this, these AD and S's and the fractures, as we know, go a little bit further. We need to be able to capture whether they're open versus closed, whether they're what their healing status is, and so on. Fractures are very detail heavy areas in this chapter, so we want to make sure we get it right. And again, these chapter specific guidelines cover such things as injury coding rules, fracture rules, initial versus subsequent on fracture encounters, how you sequence multiple fractures, and special fracture types. Again, two things to bear in mind. You have the S and the T, which is the first character. The S section provides codes for various types of injuries that are related to a single body system. The T section is a little bit different. T sections of this chapter cover injuries to unspecified regions as well as poisoning and certain consequences of external causes. Sometimes the code isn't long enough for a seventh character. And again, as we talked about before, that's when the placeholder X is used, like you can see here. So for S01.01XA, initial encounter for care of a laceration without foreign body of the scalp, that A must go in the seventh character. So to ensure that we have that in the seventh character, that's when we use the X. And the X, of course, would go in the sixth placeholder. And again, seventh character meaning initial encounter while the patient is receiving active treatment for whatever the injury is. And D is for routine healing or recovery after the active treatment. And S is for sequela. And S goes to the injury code, not on the condition that resulted from it, if you will. So you have A, D, and S is applied to the injury code, not the current condition. Fracture codes can include the fracture type, exact site, displaced versus non-displaced, laterality, and healing outcomes like delayed healing, non-union, or malunion. A term that you are probably familiar with at this point is closed, open, and displaced fractures. Let's go over what those are. Closed fractures don't break the skin. Open, also referred to as compound fractures, do. So not only do you have a fracture, you have a wound. A displaced fracture is a fracture that has two parts and they need to be realigned. A non-displaced fracture is a fracture, but the bone is remaining in alignment. If this isn't making sense, refer to the figures 22A.1, 22A.2, and 22A.3. There are other different types of fractures as well. You'll see terms like comminuted, green stick, impacted, oblique, pathologic, stress, transverse, plus malunion, and non-union. All of these different terms will drive you to the correct code. So it's very important to read fracture coding very accurately. And for fractures, seventh characters include A, which we've talked about, initial closed, B, initial open, and D, subsequent routine healing, G, delayed healing, K, non-union, P, malunion, and S for sequela. Open fractures are split up by type. And when we say type, we mean severity. So we have B, it's referring to initial open fractures, type 1 or type 2, and C is used for initial open type 3A, 3B, and 3C. And again, open fractures have these, so very important to get on top of that. More on open fractures. We have the non-union and malunion. We've addressed these before, but this kind of spells it out. We have M, subsequent encounter for open fracture type 1 or type 2 with non-union. N for subsequent encounter for open fracture type 3A, 3B, and 3C with non-union. Q, subsequent encounter for open fracture type 1 or type 2 with malunion. And R, so very important to get these things right. Thankfully, there's a section in your book when you see that a seventh character is required, you'll see what's on this slide repeated, and then you just have to apply it correctly. And here's a good test question. If a displaced versus non-displaced isn't documented, you have to code it as displaced. If open versus closed isn't documented, you code it as closed. When we have multiple fractures, we assign a separate code for each fracture unless there's a combination code in the index. Combination codes may apply when the documentation says multiple fractures at one site but lack specific details. Now we get into dislocations and subluxations. Dislocations is a bone that's displaced from a joint. And this could be a finger, thumb, shoulder. A subluxation is a partial dislocation. If you have a fracture with a dislocation, you code it as a fracture. Now we have sprains and strains. Sprains involve tendons and muscles or supporting ligaments around a joint, often from twisting. Strains are overstretching or overexertion of muscles, sometimes referred to as a partial tear. And you treat this with rest, ice, compression, and elevation, typically. Intracranial injuries are very serious, and this goes to code category SO6. This covers all the traumatic brain injuries, excluding those with the skull fracture. These characters identify the type and loss of consciousness status. Also, bear in mind, concussions only have a few specific code options, and a head injury is less specific. And this often goes and gets coded to SO9, depending on the documentation. Injuries to internal organs are coded to the injured organ or region. In the index, you look under injury internal, and then you would narrow it down by the anatomic subterm and apply the correct seventh character. And it's our old friends AD or S. With open wounds, we're referring to a wound that involves a break in the skin, a puncture, or traumatic amputation. Some of these are penetrating with both an entry and an exit wound, and they're classified by site. A crush injury occurs when a body part is squeezed between heavy objects. Crushing syndrome can be severe with muscles and bone destruction and other systemic complications. These codes are classified by site, and the main term to use would be crush or crushed. Now we're going to talk about burns and corrosions. Burns are caused by a heat source, a fire commonly, or electricity. Corrosions are essentially chemical burns. So if it's a chemical burn, it's a corrosion. Both of these are coded by site, depth, extent, and often the agent or external cause. Another thing when we code burns is we code them by the degrees. So it's important to understand what this means. A first degree burn affects only the top layer of the skin, the epidermis. The second degree burn involves the epidermis and the dermis, and these are the burns that often come with blisters. Third degree are full thickness burns. In other words, the burn has penetrated all skin layers. These are serious injuries. You get edema, you get fluid problems, you get color changes, and that is a very serious injury. Frequently, we'll have multiple burns at the same time. With burns, if you have multiple burns, you would code the site with the highest degree of burn first and then add codes for the other sites. You would only use a single multi-site code when the documentation doesn't specify each site. When burns exist with other injuries, either condition may be coded first, depending on the reason for the encounter. Non-healing burns are coded as acute burns, and infected burns require additional infection codes. Another thing that you see is the rule of 9. So basically what we do is we take the body surface and we divide it into multiple of 9s. The calculation's slightly different for adults compared to children. And we use those rule of 9s, the documentation, to select the correct extent code for the burn. And you can see it here. Here's the rule of 9s, right? So you can see the two arms, 4.5% plus 4.5%, of course, is 9, and so on. And this diagram is also in your textbook. Contusions are injuries of soft tissue. The skin isn't broken, but you have the breakage of small capillaries and bleeding occurs, right? We commonly refer to contusions as bruises. And these, of course, are specified by site and with additional specification for right, left, and unspecified. Superficial injuries are such things as abrasions, blisters, constrictions, superficial foreign bodies, insect bites, things like that. So the way to find these would be the terms injury superficial and then apply a seventh character, A, D, or S as appropriate. When a primary injury causes minor nerve or vessel damage, sequence the primary injury first and then add codes for nerve, spinal cord, or vessel injuries. If the major injury is a nerve or vessel, that injury is coded first. Injuries to region of the spinal cord are classified by type, like a complete lesion or incomplete syndrome, and by region or level, such as the cervical or lumbar. Nerve injuries are coded by the specific nerve, and each needs the appropriate seventh character. And again, as we mentioned before, these have a lot of instructional notes in this chapter, and these include such things as code first intracranial injury or code also open wound, fracture, transient paralysis. So very important to follow all these directions in the tabular. Traumatic amputation is the loss of a body part due to an accident or trauma, and this can either be partial or complete. The codes are organized by site for both upper and lower extremities. And again, we see our old friends AD or S for initial, subsequent, or sequela with traumatic amputations. And as you would expect by now, these also require the laterality in addition to the seventh character of AD or S. The Installables Unlimited Collection. Luxury laundries and beads. Now we have foreign bodies entering through a natural orifice. These codes do not include any type of foreign body that's left in an open wound, foreign body from a penetrating wound, residual foreign body. And the categories are actually the body system. So the way we would code these is in the index, look for foreign body with the subterm for site or entering through the orifice.
What's under there? Oh, it's all the things I'm FDA approved to do. Why are you hiding them?
And again, the key things to remember from this video lecture. 1, make sure that you're clear on the seventh character, the AD and S, and all the seventh characters involving the fractures. Secondly, follow the instructional notes in the tabular and be careful with the sequencing, particularly for burns and fractures. That's all I have for you. Please come back for the next video lecture where we'll finish off this chapter on injuries. Bye now.